Gail Graham, in the case of VA, who owns the patient records in your system?
Well, by statute, VA is the custodian of the record, but the information is actually owned by the patient, and the control and the release of that information is owned by the patient. We do have legal parameters for how we keep it, the duration for which we keep it, but disclosures of that information are established in the Privacy Act and in HIPAA. And I think for us too, our patients had a long history of maintaining a copy of their record that dates back to their military service. So even before provisions of HIPAA allowed for amendment and getting copies of your records, it was a very commonplace thing for the veterans to keep a copy of their medical record as they moved around.
When you want to use these records in some way to improve your care or for other purposes, do you have to go back to the patients and ask permission, or how is that handled?
We do not have to do that if we're using it for healthcare operations as stipulated by HIPAA or the Privacy Act. For some generic research that you can use de-identified data, we wouldn't have to get permission. But for instance, when it's not possible to de-identify the data, the veteran would have to provide permission to use the data.
I think, go ahead.
I think one of the big concerns, obviously, is that when it comes to whether it's life insurance or health insurance, is the information somehow going to be used for underwriting purposes that provide a disservice to individuals who are going to be reticent to have any of their information out there. I think there's ways of having protections in law that make sure that individuals can make sure and the law will make sure that, and regulators will make sure that information isn't abused in some fashion to be used contrary, but still have the information so you can make important medical decisions about how we should make sure that care is delivered, so it's care that works and not care that doesn't work.
Are there risks here, though? For example, if I now have access to all of my medical records, I know a lot more about my health as a result. I'm empowered. I'm also now responsible for truthfully answering all of the questions on an underwriting application from a payer or insurer, and as a result, and that could prevent me from being able to obtain coverage, couldn't it? Is this a real issue, Ron?
I would like, as a consumer, not to have, whether my medical records are on a server within a group health, or whether they're in a thumb drive in my home or whatever, I think that I should be the person that makes the decision about the release of that information and how I want it used. I don't think that is a decision of the insurance company or my provider or my practice. And the assumption, and why it's so important to me, is that over the years, we all of a sudden will have a change of circumstance. So all of a sudden we think, well, maybe it's important that we just take a little bit of a person's personal privacy and say that it is no longer protected. It's just my paranoia. But there's the information that is contained in my medical records. I don't think anybody should be able to access it unless I agree that it should be accessed. I think it's important to me to have that information be private, to be mine, to be under my control, and if anybody wants to know what's in it, for me to make that decision. And that'll be particularly critical as we begin to get into people's DNA and begin to have that stored within a medical record, because I don't want anybody running through my DNA and saying, here are all the risks that his DNA show he may have. So that would influence an employer or an insurance company or affect my healthcare rates. So I think the new technologies that we're going to have in healthcare, and that information is going to be stored in those files, I think mandates that there be a consent system, almost a joint ownership of that information at the minimum.
Gail, can the VA share patient records with insurance companies, with life insurers, for example?
For example, VA does bill for care that's provided for non-service connected treatment, we can provide the medical records for that treatment that was provided, with a few exceptions. We cannot provide, without a patient's authorization, we cannot provide information on drug, alcohol abuse, sickle cell anemia, HIV, and some protected diagnoses.
Why are those protected? Why are those handled differently than other conditions?
There was a special statute, USC 7332, that protected those, really to provide protections for the, it really predated some of the genetic non-discrimination, because it was felt that knowledge of those diseases would adversely affect the individual, so that they should have authority to say when that information is disclosed. So, for example, if we treat a patient for alcohol abuse, we cannot provide that information to their insurance company, not even the coded data or the medical records, without their explicit authorization.
Is there a logic to the distinction being made, really, at the end of the day? I mean, why should some conditions...
Well, I mean, it's been greatly debated, and right now for VA, it is one of the challenges we have with broader participation in things like the Nationwide Health Information Network. As it stands today, because it's not easy to detect this information in all records, we would have to assume that it's present in all records and require authorization, for example, for participation in an NHAN activity. So we've looked at, has its time passed? Are the stigma from these things really in the past? But it really, I think it's good business sense to actually keep the patient informed and to obtain those authorizations.